All right, everybody, welcome to another video. This week's video will be called The Device That Might Save Your Memories. Okay, let me just full screen that. So, the device that might save your memories. So, this is not going to be considered a miracle cure. It's a hearing aid. I think ChatGPT was just being a little bit hopeful when they posted, when I asked it to create this video of a hearing aid. But it's not really a miracle cure. It's a way that can kind of mitigate what comes from degenerative diseases. And here you have one person on the right who is who got a hearing aid, and the other person on the left who didn't get a hearing aid. You can see the person on the right is a little bit more happier, where the person on the left isn't, because the person on the right is more connected to the world, whereas the person on the right is not really connected to the world. So we'll discuss more about how this happens, and the paper by which we are going to be talking about will be kind of discussing more about what this is, what it means to have this kind of hearing loss, and how using a hearing aid can kind of help um, ensure that you are well off and able to uh, uh, fix the degenerative diseases that come with it. So the paper that we're going to be discussing today is called Association of Hearing Aids and Cochlear Implants with Cognitive Decline and Dementia. This is a systematic review and meta-analysis. This was published by JAMA Neurology, and the date of publication is 2022. You can see the authors are listed. So why does hearing matter? Hearing loss affects millions worldwide, one of the most modifiable risk factors for cognitive decline, but it does not. But does it protect the brain? We're going to find out. So what's the big question? Does using hearing aids or cochlear implants actually slow cognitive decline and cut the risk of dementia? So you have a big glowing question mark here that asks, does hearing aid help or not? So let's look at the study design. They didn't mess around. 31 studies, 137,484 people were used altogether. Hearing aid users and cochlear implant users thrown into one giant evidence pile, basically. Systematic review plus meta-analysis. So that was a big study that they did, essentially. And you can see the amount of participants they used was quite heavy. So why could hearing affect the brain? It's not one neat mechanism. It's a messy chain. Hearing loss equals to less brain stimulation, more cognitive effort just to understand speech, social isolation, depression, faster decline. So when you think about hearing loss, you have to think of it as it kind of affecting the regions in the brain that aren't being used. So there's a Hebbian hypothesis that is well known. If you don't use it, you lose it. So if those structures of the auditory canal are damaged, you're not going to be getting stimulation to the neurons that are associated with them. And if the neurons are not getting stimulated, then they're going to start dying off. They're going to start atrophying. And once they start atrophying, it can make it hard for the person to understand other people who are trying to communicate with them using those specific regions. So they're going to have to incorporate other areas of the brain, and that means it's going to be a higher cognitive load just to understand pieces of speech that could be very simple. So in most cases, it's important to get a hearing aid so that you can kind of correct those downstream auditory structures that are damaged in order to increase your chances of stimulating those neurons so that you can increase your likelihood of at least being a part of the society and not being too isolated, because people who tend to not fix these, they tend to feel like they're too much for people, and they want to kind of they want to reject themselves from society so that they can be less of a burden. And in that case, that could lead to social isolation. And if you have social isolations, that could lead to depression. And depression is going to lead to more atrophy, especially if you're already going through neurodegenerative processes in the brain. So the end all be all here is to just kind of make sure that you look after the hearing that you might have. So the two hypotheses that the were positing was the cognitive load hypothesis and the um, um, sensory deprivation hypothesis, which is sensory deprivation is losing those perceptual auditory structures that are necessary to normal hearing, and the cognitive load is the fact that you incorporate other regions of the brain to help with understanding pieces of the puzzle that come from the area by which the neurons are kind of dead already because those neurons are not receiving the proper stimulation from the auditory regions. So what's the main finding though? Here's the number that made people sit up. Hearing devices users had 90% lower hazard of long-term cognitive decline compared with people who left their hearing loss untreated. So 19% decreased problems related to cognitive decline. And I'm going to highlight uh, some illustrations here that kind of explain how this works. So basically, you have without treatment, more decline; with treatment, slower decline. This is not an association, not proof of cause. It's not a proof of cause. It's not an association, and it's not a proof of cause of effect. So approximately 3% improvement in short-term cognitive performance after hearing intervention. So basically, what that means is people who had hearing aids and those who didn't have hearing aids were put into a test group, and those who got the hearing aids fared better once they completed the test once more. And why might this happen? So you have more auditory stimulation, better social interaction, less mental effort spent decoding speech, and you have an improved quality of life. All right, strengths and limitations of the study. So they had a couple of strengths and limitations. The first strengths were the fact that they had a big sample size, the 100,000 plus people they used, multiple countries, strong overall evidence. The limitations included mostly observational. They couldn't prove hearing devices directly prevent dementia, and different study designs and follow-up periods were also a limitation of this study. Okay, what were the clinical takeaways? So getting your hearing checked obviously is the best and most positive thing you could do for yourself, whether you're going through degeneration or not. The benefits outweigh the costs because mostly it's going to improve in communication, reduce social isolation chances, and support long-term brain health, right? This could become an important part of dementia prevention strategies in the future because when you think about it, this is a very, very modifiable risk factor. Aging comes with a lot of things. Usually you have to get corrective glasses, and that comes with your ears, your eyes losing their capacity to focus into small objects. The same can be said for your ears as well. So along with getting glasses, it's important to also look at your hearing and see if you can get some hearing aids applied to you so that you can kind of be connected to the world and kind of reduce the amount of cognitive load that you're going to be putting on your brain when you don't do these things. Conclusions are that hearing aids and cochlear implants are not cures for dementia. However, they may represent one of the most practical ways to support cognitive health in people with hearing loss. So you have to protect your hearing as much as the most you can, and you have to ensure that you get the best, the best ones that you have that you can in the meantime, so that you reduce your chances of getting any type of bad diseases that come from it. So here are the feature research that was found. Hearing devices directly prevent dementia and what benefits. What biological mechanisms are responsible? That's what they don't know yet. I did talk a little bit about it, but that doesn't mean that it was proven. That's how it's gone. So it's important that the key takeaway here is that when you get to a certain age and you feel like your hearing is going away, or you feel like one of your loved ones' hearing is going away, send them to an audiologist, see if they can get a hearing aid fixed onto them. That way they can kind of lessen the chances that they might have on having any degeneration. I know the burden that comes with this type of things is very big. So guys, thanks for watching the video, and I hope you enjoyed it. If there's any critiques, just go ahead and let me know, and I can try to work on those as much as I can so that I can you know um improve my videos in the future. So yeah, thanks for tuning in. Take care. Bye.